Hey guys, I just made a post yesterday on a new World Health Organization guideline on tobacco cessation, and a lot of people are asking whether they included e-cigarettes as a tool to help people to quit smoking. And a big part of the reason for that is this trial that just came out in JAMA Internal Medicine just 2 weeks ago. So there was a trial published in January in JAMA comparing varenicline with e-cigarettes and nicotine replacement, but unfortunately that trial ended up getting retracted. There were some problems with the data. So now we have this trial that compares 12 weeks of varenicline versus e-cigarettes with nicotine versus placebo, and looks at smoking cessation rates 6 months after the intervention, and finds that about 40% of the people who either got e-cigarettes with nicotine or who got varenicline had successfully quit, compared to 20% of those who had placebo. What's important is that everybody got some counseling, some motivational interviewing. So we already know that e-cigarettes from other studies are as effective, and in some cases more effective, than nicotine replacement for smoking cessation. And according to this study, they're as effective as varenicline, which really is our most powerful tool that we currently have for smoking cessation. So will e-cigarettes have a role in smoking cessation? I think for a lot of us who already do this work, they do have a role. Once we've exhausted all the other possibilities that are more proven by evidence and safer. Patients will often turn to this without even asking their doctors, and then report back that they have successfully quit with the use of e-cigarettes. The challenge we often face, and what you don't see in these kinds of studies, is at that 6-month mark where people have finished their varenicline, how many of those people who were randomized to the e-cigarette arm are still using those nicotine e-cigarettes? So have you traded one addiction for another? And purportedly, it's a harm reduction strategy. Purportedly, it's a lower risk addiction, but we don't know that. We don't have those long-term studies. So that's the asterisk that we would place next to these equivalent studies, saying, yeah, maybe as effective for that short-term cigarette quit, but what happens to people who end up being long-term e-cigarette users? The other asterisk, of course, is that this is for people who are smoking and potentially using this to help quit as a harm reduction strategy. There's a whole bunch of other people out there who never smoked and are using e-cigarettes recreationally and then getting hooked on the nicotine in those e-cigarettes and going on to have this new addiction. So major concern there as well. So still lots to learn in this area. And as a respirologist, I really hope we see more trials like this, because right now it's really hard to know what to say in terms of counseling when patients ask us if they should be using nicotine e-cigarettes to help them to quit.